Hello, everyone. I'm Dr. Brett Dworkis with Performance Chiropractic here in Olathe, and I'm so glad that you're able to listen in to our seminar, Everything You Need to Know About Knee Pain. This one has been a little bit in the coming, but the knee is actually an area that I'm well versed in. Many of you know that I have a degree in biomechanics, and the subject of my ongoing thesis throughout my upper division studies was actually the biomechanics of the knee. So this is a joint of particular interest to me. So let's get into it. Knee pain can significantly change your life. The pain and loss of the ability to move the knee is enough to make a person consider the possibility of becoming a shut-in, because moving around is simply too painful. Getting up from chairs, getting into and out of the car, standing for long periods of time, grocery shopping, going up and down stairs, walking, and even sitting down on the stool is difficult when you have knee pain. When people start experiencing the debilitating pain that the knee is capable of inflicting, they will many times resort to over-the-counter pain drugs or go to their MD for higher power and therefore more dangerous pain medications, or seek out an orthopedist and start contemplating surgery. But there's another option that many people simply don't even know about. Chiropractic offers treatment that can often give patients back part or all of the mobility of the knee joint, depending on the actual diagnosis. Treatments will also decrease pain levels without medication, without pain, and without any addictive substances. Knee pain is pain in and around any part of the knee. The location of this pain gives doctors a clue as to what's wrong with your knee. For example, if your pain is above the knee, it can mean that the quadriceps tendon has been damaged. Pain behind the knee usually indicates a Baker's cyst or arthritis. Pain below the knee is sometimes found in children and may mean the child has Osgood-Schlatter disease, which is a problem where the growth of the knee actually can't keep up with the growing process, and the attachment of the patellar tendon into the tibial plateau actually gets irritated. Pain in front of the knee may be due to arthritis or patellar tracking disorders, where the round knee of the patella, that bone is not tracking correctly as you walk and move. Pain on the inside or outside of the knee could mean a meniscus or collateral ligament tear or arthritis. Whatever the diagnosis of knee pain is, will really determine the best treatment. Knee pain is often started with trauma to the knee. For example, someone might be standing still while another person or a big dog bumps into them, knocking the knee out of alignment. This happens a lot in contact sports such as football, basketball, and soccer. Repetitive injuries or repetitive stresses on the knee can also cause knee pain that's persistent. Pressure on the knee from carrying heavy items may also cause knee pain to occur sporadically. Now, once there's an injury to the knee, arthritis can set in. And unfortunately, we know that it can set in very quickly. Knee pain may also occur from different types of arthritis, such as rheumatoid arthritis, gouty arthritis, or immune system disorders such as lupus. It's not common, but sometimes tumors in the knee or venous return problems may also be the cause of knee pain. Now, one cause of knee pain that is usually not considered much is knee pain that results from the bones of the foot being out of alignment, or when the foot's not functioning properly. If the feet have fallen or overpronating, the whole foot flattens out during walking, and this begins to cause further problems on up the kinetic chain, causing problems with the rest of the skeleton. Remember the old song, the foot bone's connected to the ankle bone's connected to the knee bone, and so forth and so on. The entire skeleton is connected, and many times problems start all the way down at the bottom of the feet. So evaluating and treating the bones that are out of alignment is one of the easiest ways for our office to be able to help you. Now, chiropractic works for those who are young as well as those who are older. There was a study at Virginia Commonwealth University where researchers and their team surveyed 1,121 adults over the age of 65 years old who had knee arthritis causing joint pain and their use of chiropractic care during a 4-year follow-up. About a third of them had been using chiropractic care. Those who used chiropractic care and massage therapy were the ones who had better knee function than those who didn't. In Australia, chiropractors proved that it didn't take long for patients who were between the ages of 47 and 70 with chronic knee pain from arthritis to feel better. Patients either received treatment that consisted of chiropractic manipulation of the knee with interferential therapy or a placebo treatment. Interferential therapy is an electrical therapy, and it's one of the older therapies used by chiropractors. It's been used since before the 1980s, and it still works really well. The chiropractic treatment for knee pain involved 3 sessions per week for only 2 weeks, for a total of 6 visits. Now, those who received chiropractic knee treatment had significantly less pain, significantly greater knee mobility, and were significantly better at being able to perform general activities, and there was no negative side effects from the treatment. Now, every chiropractor works differently in their office, utilizing different tools and selecting the best treatment that they've already seen work well with patients. Some chiropractors use a light therapy called low-level laser therapy or cold laser treatments with great success. This is a therapy that emits light for the purpose of healing the tissues that are injured. It increases the blood flow and decreases inflammation in the process of healing. The light is super pulse laser emitting red and infrared light, and it slightly warms the skin it's aimed at and doesn't hurt at all. In one study of 86 patients with knee pain, there was a significant reduction in the pain when cold laser treatment was used. The knee pain significantly improved by the 10th visit, and these types of results are the ones that chiropractors and patients both get really excited about. Who wouldn't? Now these patients can get back to life as usual. So, if you've had knee surgery, does that mean that you can't have chiropractic care? Chiropractic care is especially important after knee surgery. At one of the main chiropractic schools in the United States, National University, located outside of Chicago, chiropractors reported on their care of a 26-year-old ice hockey goalie who had already had knee surgery. He continued to have mild discomfort and swelling in his left knee a month after the surgery. No matter what he did, he couldn't heal completely. The chiropractors helped him with manipulation of the knee with the goal of restoring full range of motion and to provide him with therapies for better balance and strength. They wanted to improve his ability to feel the sensation of where his knee was in space. This is something we call proprioception, and also improve his endurance. All the ice hockey players' symptoms were relieved after just 14 weeks of care, which may seem like a long time, but for anybody who's experienced knee pain, it's really not that long. Now, full restoration of motion with decreased knee pain is possible. Chiropractors around the world confirm similar cases where knee pain and decreased mobility were reversed with good chiropractic care. In Australia, a case of a 60-year-old woman who had a medial meniscus tear with knee pain and swelling received ultrasound, rest, ice, and compression therapy at the chiropractic office, and she elevated her leg at home so it could heal. Her chiropractor also manually manipulated her knee and used sports taping to the muscles to strengthen the muscles as well. She got the complete royal treatment plan, and her chiropractor was committed to 100% total healing and nothing less. At the end of her 12th treatments, she could walk, swim, and ride a bike without any pain whatsoever. So, what can you do for your knee pain, even besides going to a chiropractic office or to another doctor? There are always positive steps you can take to reduce your knee pain. The first thing you want to do is to ice your knee. When the pain is greater, icing your knee is very beneficial to numbing the pain and decreasing the inflammation in your knee joint. To ice your knee, you want to follow these simple steps. Raise your knee to at least the level of your hip by resting it on another chair or sitting on a recliner that allows your knee or lower leg to be raised. You want to lay a towel down over the place in your knee where it hurts. Then you're going to add an ice pack or an ice gel pack that's also covered with a tea towel. If you don't have a professional ice pack, look for something in your freezer that may act as a substitute, such as a bag of vegetables or like peas or corn. This may sound funny, but bagged veggies can work really, really well. They conform to the area that's being iced, and they stay cold for long enough to be able to do the job. And they work just as well as an ice pack as long as they're frozen. Now, countless patients in my office have used this with great success, and of course an ice pack is a lot more professional, but the frozen vegetables will do just fine. Now, cover your knee with another towel over the ice and let the ice do its work for 10 or 15 minutes or until your knee is numb. You only want numbness here, not frostbite, so don't overdo it. The towels protect you from over-icing your knee. Once you remove the ice and the towels, begin moving your knee by walking. The pain should be significantly less, and you repeat this process every hour or so if you have to. The next thing you want to do is to limit your activities. Since knee pain is worsened if you continue doing activities, things like walking, jumping, and running, it's imperative to cut back on the activities that aggravate the knee. As difficult as it is to cut back on the sports you love, your knee needs a little extra TLC when you have knee pain, so give it time for a full recovery. For example, if you're a distance runner and you run 10 miles 5 times a week, cut that amount down to a fifth, maybe 2 miles 5 times a week. Even this may be too much for your knee to handle, so be prepared to give up running altogether for a period of 4 to 6 weeks. Are you stretching before your activity? Stretching the knee warms up the muscles and brings extra circulation to them to help prevent extra strain on damaged areas. You want to stretch 3 primary areas. You want to stretch your calves, you want to stretch your hamstrings, and you want to stretch your quadriceps. Stretch your calves by standing in front of a wall about 12 to 18 inches away from the wall and lead into the wall, resting your forearms on the wall. Hold this for about 30 seconds, pushing your heel down into the floor, and repeat this about 3 times. Next, for the hamstrings. With your leg or legs out in front of you, gently lead forward like you're trying to reach for your toes. If you can't reach your toes, that's okay. Just reach for your knee or your calf, or use a belt or a towel around your foot. You want to hold that stretch without bouncing for about 20 to 30 seconds and repeat this 2 to 3 times. Last is the quadriceps. And you want to stretch your quadriceps by standing, grabbing your left ankle with your right hand, and pulling your ankle slowly towards your buttocks. You will feel a stretch in front of your leg in the quadriceps, which connects to your patella. Now, you will oftentimes see this done using the same side hand to hold the ankle. I highly recommend not doing the stretch this way. While we simplify the understanding of the knee by saying that it's a hinge joint, it's actually a complex joint which has a twisting motion during flexion and extension. We call this the screw-home mechanism, and due to this, if you stretch the knee by holding your ankle with the same side hand, you could actually stress the medial collateral ligaments and place undue stress on the meniscus. So stick to stretching using the opposite side hand to hold your ankle. Again, just like the hamstring, do this stretch statically, not bouncing, and hold it for 20 to 30 seconds, 2 to 3 times. Now, there are certain activities that you want to avoid. There are distinct activities that increase the stress and strain on the knee. So when you have knee pain, avoiding these activities gives your body a chance to heal. Here's a list of activities to avoid. Running on hard surfaces such as concrete or cement, running uphill or running downhill, jumping rope or jumping up and down. So stop jumping on the beds, kids. And bicycling with the seat too low. Now, notice that I said avoid riding a bicycle with the seat too low. This can put a lot of stress on the knee. However, riding with the seat properly adjusted can be one of the best rehab exercises to do for a recovering knee. In fact, it's bicycling that's commonly used during prehab before knee surgery and rehab after knee surgeries. The last thing to watch out for is running with worn-out running shoes. Most running shoes have a life of up to about 6 months, give or take, depending on how many miles per week you're running. So take a look at your shoes as well. And then there are certain sleeping positions that can aggravate back problems and knee problems. Even neck problems may be aggravated by certain types of pillows that are exceptionally large and fluffy. By sleeping with a pillow in between your knees when lying on your side, or underneath your knees when lying on your back, you can place your knee in its ideal position, resting it fully. Now, as I mentioned earlier, flat feet can eventually lead to knee pain. Overpronating your feet when you walk leads to knee pain. Overpronating means that your feet are rolling inward when you walk. When your ankles rotate inward, the knee is going to follow, placing it in a weak position and stressing primarily the medial side of the knee compartment. If the arches of your feet have fallen, this can cause your feet to overpronate. So by adding orthotics that have built-in arch supports, your arches are supported up to the place in space where your feet will not overpronate. Many orthotics also have a deep heel cup that will assure that your foot will be aligned as you walk, preventing foot disorders from occurring. The more you can keep your foot aligned, the less you're going to be prone to knee pain. There's a simple solution to flat feet: adding proper orthotics to your feet. And we can assist you with the selection of these orthotics if you choose that that's something you want to look at in our office. And we can help you customize those orthotics specifically to your feet. So how do you check your shoes? it's possible that your shoes have worn down and now need to be replaced. Just like overpronation, if your shoes are wearing down on the inside of the sole, it's going to result in your lower legs turning inward and your knees knocking. This puts you at more risk for knee pain, and if you already have knee pain, then worn shoes can worsen it. New shoes might help quite a lot. And lastly are ointments. And we get a lot of people that ask if they should use topical ointments for knee pain or other kinds of pain in the body. Well, there are many different types of herbal ointments on the market that may be used for the reduction of joint pain. Some of these contain arnica, capsicum, comfrey, menthol, and other ingredients, but your personal chiropractor will always recommend what type of ointment will be best for you. Researchers in Tulsa, Oklahoma, found that a significant decrease in pain and stiffness was found between the first 21 days of application of an ointment and the last 21 days. The therapeutic effects were really only evident when the ointment was used for longer periods of time, so we're talking 3 to 6 weeks here. A lot of people just don't want to wait that long. So, about chiropractic. Chiropractic is a drugless method of natural healing that focuses on the alignment of the skeleton and stimulating the nervous system to begin the healing process. Every joint may be manipulated to restore proper nervous system impulses throughout the entire body, sending messages to the immune system and every organ to begin healing. And there are no side effects to chiropractic. Chiropractic goes back to the beginning of time. Even Hippocrates, the father of medicine, recommends manipulation of the spine and other joints. So, don't let your knee pain go untreated when natural healing is made possible via chiropractic treatment. I really hope that you learned something this evening and that you might use some of these tips in order to reduce knee pain that you might be feeling. We're available at Performance Chiropractic to help if you have any questions, so please call the office to make an appointment if you want to find out if we might be able to help you. Remember that you can find us on our website at www.myperformancechiropractic.com. You can find us on Facebook at Performance Chiropractic-Olathe, or feel free to email us at performancechiropractic@yahoo.com. And that's performance_chiropractic@yahoo.com. Or feel free to call us anytime at 913-782-5000. Thanks again for joining us this evening. We hope that you can meet your goal of a pain-free knee. And if there's anything that we can do to help you, please give us a call. Have a great day.